morning. I am Mrs. Patricia Tiange Kanneh, nurse anesthetist from Sierra Leone. I had an accident in May 2022, which had been of serious trouble and constraint that made me stop working since then. And my orthopedic surgeon in Sierra Leone advised that I should come to India for surgery, replacement to be precise. How to go about this had been a challenge since May. I was about, because it had to be a government funding program. It was not easy. Fortunately, I have a colleague who had done the same surgery in India before, Suri, and I was referred to Suri. Suri has been helping with some others to put documents together through this process, and by God's grace, we finally succeeded in November. And November 27th, we left Sierra Leone to come to India for this surgery. We arrived in India on the 29th, and Suri introduced me to Med Access. Even before I arrived in India, he had already started the process with Med Access. I never communicated with them. He has been like the intermediary. I never knew Med Access. We have been doing the communications, doing the transactions, and I came. Med Access visited me. They sent somebody to receive me at the airport, which was very swift. I appreciated that because I've never been to India. Strange, I know nobody here. So it brought me. I came with my daughter, a graduating student at university doing law. We came together. We came to an apartment. We were welcomed. Madam Shashi called to know whether we arrived, welcomed me in India. It was very nice from the beginning, and I was assured that I would be taken care of. So right then I started being in confidence that I am in good hands. And so we also will call and tell me, don't worry, those people will take care, we're in good hands. The next day, they visited me as a team on Med Access and assured me that there will be somebody to manage our case. That is, take us around since there is challenge with language, there is language barrier. We speak English, and this person, Mr. Lalit, to be precise, was very, very useful, very helpful to us. So from that, Lalit was now in charge. Almost every day, Mr. Lalit would go to our place. He took us to the hospital, the Nanat, where we saw the surgeon. The very first day, the surgeon was not on duty. We met the assistant doctor who saw us. They were very accommodating. We started the process of investigations, laboratory investigations. So many laboratory investigations, different from the heart to blood tests, urine tests, and everything. So very, very effective, well-organized system. And the next day, I went back and I saw my surgeon, Dr. Mahesh. He was also very accommodating. He assured me you'll be okay. You will walk straight after surgery. I promise you, and the pain will go. Initially, humanly, I have been worried because being a nurse, I've learned that it's a complicated surgery. It's going to take a long time, and they're going to involve foreign body implantation, so it has been my worry. But I was encouraged and assured. And after the lab investigations, a few days after, precisely on the 8th, I went to the hospital for admission. On the 9th, the surgery was performed under anesthesia. All over the nurses, the theater staff, the nurses on the ward, They are just very skillful people, very pleasant, very caring. And so the whole process went on after surgery. Just 4 days after surgery, I was out of hospital. Even before being discharged, just the second day, I was asked out of bed to start physiotherapy, which was very amazing. And I realized I was doing it successfully. It was very amazing. So just 4 days, I was discharged. Initially, the pains, there were severe pains, but the analgesics, the other drugs I was put on were very helpful. We went to our apartments where we were lodged, and I started with physiotherapy at home. There was a therapist assigned to me that came for about 5 days. Every day we come and do the practices. I continued with my treatment, and initially it was painful, but as time went on, in fact, after the 5 days, I was able to do the practices on my own, and it's just like a miracle. It's really the hand of God. It's very swift. Now the pains have subsided greatly. What used to be a mountain is now seems to be very easy. I'm using my walking aid very swiftly. I do my exercises on my own. I walk around, and in all this, Med Access have been very, very caring, concerned. They have been monitoring. Madam keeps calling, Lani to come around, and all of these people, they will come. Since we are Africans, we are not too comfortable with the Indian diet. So my daughter, they went to show my daughter where to get food stuff. Lalit and my daughter will go out to get food stuff, we prepare our own dish on our own. So virtually we are very comfortable. Even in the apartment, there is everything. There is internet facility, there is water flowing, we have drinking water. Somebody comes in to clean our place. We are very comfortable with that. That means because of the internet facility, we are not too lonely, because when they are not around us, we have opportunity to call back home our people, we talk with them, relate with them. So by and large, it has been a very interesting experience, and I'm very satisfied. Initially, my husband was very, very worried about this surgery, but seeing me, the way we will be talking, the way I'm comfortable, the way he see me cheerful, he is now very comfortable, he is relaxed, he's testifying that he's very happy about my countenance, and I'm also very happy. I'm satisfied with the entire process. I have come to conclusion that Med Access is a very good project, a very helpful one, to especially foreign patients coming in, international patients, because imagine you coming in, language barrier, you don't know anybody in the place, you don't speak their language. If there is nobody around you that will guide you through the process, to save time, save embarrassment, emotional and psychological stress, it will be very difficult. But these people will guide you through to the right doctor. I was very satisfied with the doctor I was placed under. So the right doctor, doing the right investigation, the right place, the correct treatment. So we need a project like this. And so I'm very, very satisfied with Med Access. Even after this process, when I will go back home, I have all the confidence and the assurance to motivate other patients in my country to come through Med Access anytime they are sent to India for treatment, be it surgical or around medical treatment. I think this is a very good family to reckon with. So I'm very, very satisfied. I'm happy. I came worried with a lot of questions in my mind, but I am going back satisfied. All my questions have been answered. I thank God for all that He has done. I'm very, very happy. I'm very grateful. Thank you very much. I thank God, and I thank God for Med Access. Mrs. Shasi and team, I'm very, very grateful.